Phlebotomy Certification Exam Quality Assurance Review. Question 1. When preparing for collection, which practice is part of phlebotomy quality assurance in the outpatient clinic during a competency review? Option A. Ignoring mislabeled specimens if the patient is well known. Option B. Tracking specimen errors and using corrective action to prevent recurrence. Option C. Changing tube labels after results are reported. Option D. Skipping competency checks for experienced staff. The correct answer is option B. Tracking specimen errors and using corrective action to prevent recurrence. Quality assurance identifies errors and improves processes so patients receive reliable results. Familiarity with a patient does not make a mislabeled specimen acceptable. Changing labels after reporting hides errors and compromises traceability. Competency checks help maintain consistent safe practice for all staff. Question 2. Why are competency assessments important for phlebotomists in the hospital unit during morning rounds during a final review? Option A. They replace all written procedures. Option B. They allow staff to ignore order of draw. Option C. They verify that staff can perform required skills safely and consistently. Option D. They are only for patients who complain. The correct answer is option C. They verify that staff can perform required skills safely and consistently. Competency assessment supports safe patient care and consistent specimen quality. Written procedures are still needed as standards for practice. Order of draw remains important regardless of competency status. Competency is a proactive quality process, not only a reaction to complaints. Question 3. Before proceeding with the draw, which error should be reported through the facility's quality process in the urgent care laboratory during a study session? Option A. A patient correctly states their date of birth. Option B. A tube is mixed according to instructions. Option C. A needle safety device is activated after use. Option D. A specimen collected in the wrong tube type. The correct answer is option D. A specimen collected in the wrong tube type. Wrong tube collection can cause test cancellation or inaccurate results and should be tracked for improvement. Correct identity confirmation is expected practice, not an error. Proper tube mixing supports quality. Activating a safety device after use is the intended safety behavior. Question 4. Why should a phlebotomist follow the facility procedure manual rather than personal shortcuts in the pediatric clinic during a structured exam prep drill? Option A. Standard procedures support consistent safety, quality, and regulatory compliance. Option B. Shortcuts are always faster and safer. Option C. Procedure manuals are only for new employees. Option D. Regulations do not apply to outpatient settings. The correct answer is option A. Standard procedures support consistent safety, quality, and regulatory compliance. Written procedures create a consistent standard that reduces variation and errors. Shortcuts can bypass safety checks and increase risk. Experienced staff are also expected to follow current procedures. Regulatory and safety expectations apply across collection settings. Question 5. In the long-term care unit, which action helps prevent wrong tube errors? Option A. Choose the tube color by memory only when uncertain. Option B. Compare the test order with the required tube guide before collection. Option C. Use lavender tubes for every test. Option D. Collect any tube and let the lab transfer it later. The correct answer is option B. Compare the test order with the required tube guide before collection. Matching the order to the tube requirement before the draw reduces recollection and inaccurate testing. Memory alone is risky when the collector is uncertain. One tube type cannot support every laboratory test. Transferring specimens later may be unsafe, unacceptable, or impossible for some tests. Question 6. For a type and screen collection, which action helps reduce pre-analytical errors? Option A. Focus only on drawing blood quickly. Option B. Let the laboratory fix all collection problems. Option C. Verify patient, tube, timing, handling, and labeling before sending the specimen. Option D. Use the same tube for every order. The correct answer is option C. Verify patient, tube, timing, handling, and labeling before sending the specimen. Most laboratory errors can occur before analysis, so careful collection and handling are essential. Speed without accuracy can increase errors. Some collection problems cannot be corrected after the fact. Different tests require different specimen types and additives. Question 7. A patient becomes pale and says they feel dizzy during a blood draw. Which response is safest in the emergency department bay during a mock exam? Option A. Ask the patient to stand up and walk it off. Option B. Leave the needle in while getting more tubes. Option C. Give the patient food before removing the needle. Option D. Stop the draw, remove the needle, lower the patient's head or position safely, and seek help as needed. The correct answer is option D. Stop the draw, remove the needle, lower the patient's head or position safely, and seek help as needed. Dizziness may signal syncope, so the priority is preventing injury and stopping the procedure safely. Standing can lead to a fall. Leaving the needle in place while symptoms progress increases injury risk. Food is not the first action while a needle is still in the arm. Question 8. After drawing a patient who takes anticoagulants, what post-puncture step is especially important in the physician office lab during a skills check? Option A. Apply firm pressure longer and verify bleeding has stopped before bandaging. Option B. Skip pressure to avoid bruising. Option C. Ask the patient to bend the elbow sharply. Option D. Use the same bandage time for every patient without checking. The correct answer is option A. Apply firm pressure longer and verify bleeding has stopped before bandaging. Patients on anticoagulants may bleed longer, so pressure and reassessment help prevent continued bleeding or bruising. Skipping pressure increases bleeding risk. Bending the elbow can promote bruising instead of controlled pressure. A fixed time without checking may miss ongoing bleeding. Question 9. When preparing for collection, which action helps prevent a hematoma after removing the needle in the community health screening event during a practice drill? Option A. Have the patient bend the elbow tightly. Option B. Apply clean gauze with firm pressure while the arm remains straight. Option C. Rub the puncture site to spread the blood. Option D. Remove the needle before releasing the tourniquet every time. The correct answer is option B. Apply clean gauze with firm pressure while the arm remains straight. Focused pressure with the arm straight helps seal the puncture site and limit bruising. Bending the elbow may increase leakage into tissue. Rubbing can disrupt clot formation and worsen bruising. The tourniquet should be released before needle removal to reduce pressure in the vein. Question 10. Bright red pulsating blood appears unexpectedly during a draw. Which concern should the phlebotomist consider in the preoperative testing area during a scenario? Option A. Proper venous flow. Option B. Tube additive carryover. Option C. Possible arterial puncture. Option D. Normal capillary refill. The correct answer is option C. Possible arterial puncture. Pulsating bright red blood can indicate arterial access and requires stopping the procedure and applying pressure. Typical venous flow is darker and not pulsatile. Additive carryover affects specimen chemistry, not blood pulsation. Capillary refill is assessed in tissue color return, not tube blood flow. Question 11. Before proceeding with the draw, which tube is collected first when blood cultures are ordered with other venipuncture tubes in the Oncology Infusion Center during a competency review? Option A. Lavender EDTA tube. Option B. Gray fluoride tube. Option C. Serum separator tube. Option D. Blood culture bottles or sterile culture tube. The correct answer is option D. Blood culture bottles or sterile culture tube. Blood cultures are collected first to reduce contamination of the sterile specimen, EDTA tubes are collected later to prevent additive carryover. Gray tubes are generally collected after other additive tubes. Serum separator tubes do not take priority over sterile blood culture collection. Question 12. In the standard venipuncture order of draw, which tube usually follows blood cultures in the dialysis adjacent clinic during a final review? Option A, light blue sodium citrate tube. Option B, lavender EDTA tube. Option C, gray fluoride tube. Option D, royal blue tube for every test. The correct answer is option A, light blue sodium citrate tube. The light blue citrate tube is collected early to protect coagulation testing from additive contamination. EDTA is collected later because it can interfere with coagulation and chemistry tests. Gray fluoride tubes are usually near the end of the order. Royal blue tubes are used for specific trace element testing, not as the universal second tube. Question 13. In the Student Skills Lab, which order is most appropriate for collecting blood cultures, light blue, serum, green, lavender, and gray tubes? Option A, lavender, gray, green, serum, light blue, blood cultures. Option B, blood cultures, light blue, serum, green, lavender, gray. Option C, gray, lavender, green, serum, light blue, blood cultures. Option D, serum, lavender, blood cultures, gray, light blue, green. The correct answer is option B, blood cultures, light blue, serum, green, lavender, gray. The standard order minimizes additive carryover by collecting sterile cultures first, citrate early, then serum, heparin, EDTA, and glycolytic inhibitor tubes. Starting with lavender risks EDTA contamination of later tubes. Starting with gray places fluoride/oxalate before tubes that could be affected by carryover. Placing cultures after non-sterile tubes increases contamination risk. Question 14. Why does order of draw matter during evacuated tube collection in the occupational health clinic during a structured exam prep drill? Option A. It makes patient identification optional. Option B. It eliminates the need to mix tubes. Option C. It helps prevent additive carryover from altering later specimens. Option D. It determines the patient's fasting status. The correct answer is option C. It helps prevent additive carryover from altering later specimens. Additives from one tube can contaminate another tube if collection order is incorrect. Patient identification is required regardless of tube order. Additive tubes still need proper mixing after filling. Fasting status is based on patient preparation, not tube sequence. Question 15. During capillary puncture, which specimen type is generally collected first when ordered in the blood collection station during a clinical simulation? Option A, serum specimen. Option B, gray top microtube. Option C, non-additive tube after all others. Option D, blood gas specimen. The correct answer is option D, blood gas specimen. Capillary specimens are collected in an order that protects tests most affected by clotting and air exposure, with blood gases first when required. Serum is not first when blood gases are ordered. Gray microtubes are collected after more time-sensitive capillary specimens. Non-additive tubes are not automatically collected first in capillary order. Question 16. After reviewing the order, which capillary collection order is commonly used after blood gases when EDTA testing is ordered in the outpatient clinic during a review? Option A, EDTA microtube before other additive and serum microtubes. Option B, serum microtube before EDTA for every draw. Option C, gray microtube first even when blood gases are needed. Option D, any order because capillary tubes have no additives. The correct answer is option A, EDTA microtube before other additive and serum microtubes. EDTA microtubes are collected early in capillary collection to reduce clotting in hematology specimens. Serum first collection can allow clotting before the EDTA specimen is filled. Blood gases are more time sensitive and generally come first if ordered. Many capillary tubes contain additives, so order still matters. Question 17. When preparing for collection, which tube is most appropriate for a routine CBC in the hospital unit during morning rounds during a mock exam? Option A, light blue sodium citrate tube. Option B, lavender top tube containing EDTA. Option C, gray sodium fluoride tube. Option D, red no additive tube. The correct answer is option B, lavender top tube containing EDTA. EDTA preserves cellular morphology and prevents clotting for hematology testing such as CBC. Citrate is used mainly for coagulation testing. Gray tubes are commonly used for glucose or lactate preservation. A red tube allows serum testing and is not the standard choice for CBC. Question 18. In a routine phlebotomy scenario, which additive is found in a light blue tube used for patient and APTT testing in the urgent care laboratory during a skills check? Option A, EDTA. Option B, sodium fluoride with potassium oxalate. Option C, sodium citrate. Option D, lithium heparin. The correct answer is option C, sodium citrate. Sodium citrate binds calcium in a controlled ratio so coagulation testing can be performed accurately. EDTA is used mainly for hematology and can interfere with coagulation testing. Fluoride/oxalate is used mainly to preserve glucose or lactate. Heparin is used for plasma chemistry tests rather than routine patient or APTT tubes. Question 19. Before proceeding with the draw, which tube is commonly selected for many serum chemistry tests when gel separation is desired in the pediatric clinic during a practice drill? Option A, lavender EDTA tube. Option B, light blue citrate tube. Option C, gray fluoride tube only. Option D, serum separator tube with clot activator and gel. The correct answer is option D, serum separator tube with clot activator and gel. A serum separator tube allows clotting and then separates serum from cells using gel after centrifugation. EDTA plasma is not serum and can interfere with some chemistry tests. Citrate plasma is intended primarily for coagulation testing. Gray tubes preserve glucose but are not the general serum separator choice. Question 20. During a scenario, which tube is commonly associated with heparinized plasma chemistry testing in the long-term care unit during a scenario? Option A, green top tube. Option B, lavender top tube. Option C, light blue top tube. Option D, pink top tube. The correct answer is option A, green top tube. Green top tubes commonly contain heparin, which prevents clotting and provides plasma for chemistry testing. Lavender tubes contain EDTA for hematology. Light blue tubes contain citrate for coagulation testing. Pink tubes contain EDTA and are commonly used for blood bank testing. Question 21. In the mobile collection site, which tube is most commonly used for glucose preservation when testing may be delayed? Option A, plain red tube only. Option B, gray top tube with sodium fluoride and an anticoagulant. Option C, light blue citrate tube. Option D, blood culture bottle. The correct answer is option B, gray top tube with sodium fluoride and an anticoagulant. Sodium fluoride inhibits glycolysis, helping preserve glucose concentration before analysis. A plain red tube does not contain glycolysis inhibitor. Citrate is used for coagulation studies, not routine glucose preservation. Blood culture bottles are for detecting microorganisms, not preserving glucose. Question 22. For a lipid panel collection, which tube is commonly used for blood bank testing such as type and screen? Option A, gray top fluoride tube. Option B, light blue citrate tube. Option C, pink top EDTA tube. Option D, green heparin tube for every blood bank test. The correct answer is option C, Pink top EDTA tube. Pink top EDTA tubes are commonly used for blood bank specimens because they preserve cells and prevent clotting. Gray tubes are associated with glucose or lactate preservation. Light blue citrate tubes are for coagulation testing. Green heparin tubes are not the routine tube for type and screen. Question 23. To protect patient safety, which tube is generally collected for a blood culture specimen in the physician office lab during a study session? Option A, lavender EDTA tube only. Option B, gray fluoride tube. Option C, SST after clotting. Option D, sterile blood culture bottle or SBS containing culture tube according to policy. The correct answer is option D. Sterile blood culture bottle or SBS containing culture tube according to policy. Blood cultures require sterile collection into a culture system designed to support organism recovery. A lavender tube is not designed as the primary blood culture container. A gray tube preserves glucose and does not support blood culture protocols. An SST is for serum separation, not microorganism culture. Question 24. Why must a light blue citrate tube be filled to the proper level in the community health screening event during a structured exam prep drill? Option A. The blood to anticoagulant ratio must be correct for coagulation results. Option B. The tube color changes if underfilled. Option C, EDTA needs extra room to mix. Option D, serum cannot clot unless the tube is full. The correct answer is option A. The blood to anticoagulant ratio must be correct for coagulation results. Coagulation testing depends on a precise citrate to blood ratio, commonly described as 1 part citrate to 9 parts blood. Tube color does not change to warn of underfilling. EDTA is not the additive in a light blue citrate tube. Light blue tubes contain anticoagulant and are not collected to obtain serum clotting. Question 25. After collecting an additive tube, how should it usually be mixed in the preoperative testing area during a clinical simulation? Option A, shake it hard until bubbles appear. Option B, gently invert the tube the recommended number of times. Option C, leave it unmixed until centrifugation. Option D, open the stopper and stir with a wooden applicator. The correct answer is option B. Gently invert the tube the recommended number of times. Gentle inversion evenly distributes additive while reducing cell trauma. Vigorous shaking can cause hemolysis. Failure to mix can allow clotting or poor additive action. Opening a tube risks exposure, contamination, and specimen loss. Question 26. In a routine phlebotomy scenario, which problem can occur if a lavender EDTA tube is not mixed soon after filling in the oncology infusion center during a review? Option A. The tube becomes sterile for culture. Option B. The specimen turns into serum. Option C, microclots may form and make hematology results unreliable. Option D. The sodium citrate ratio improves. The correct answer is option C. Microclots may form and make hematology results unreliable. EDTA must contact the blood promptly to prevent clot formation in hematology specimens. Mixing does not create sterility for culture testing. A lavender tube is intended for anticoagulated whole blood or plasma, not serum. Sodium citrate is not the additive in a lavender EDTA tube. Question 27. Before proceeding with the draw, which practice helps reduce hemolysis during a routine therapeutic drug level collection? Option A, force blood rapidly through a small needle. Option B, shake additive tubes vigorously. Option C, pull back a syringe plunger as hard as possible. Option D, use appropriate needle size and gently invert tubes instead of shaking them. The correct answer is option D. Use appropriate needle size and gently invert tubes instead of shaking them. Gentle handling and appropriate equipment reduce red blood cell rupture. Forcing blood through a small needle can damage cells. Vigorous shaking is a common cause of hemolysis. Excessive syringe force can rupture cells and compromise results. Question 28. During a skills check, which laboratory result is especially affected by hemolysis because red cells release intracellular contents in the student skills lab during a skills check? Option A. Potassium may be falsely increased. Option B. Patient date of birth becomes invalid. Option C. Tube expiration date is extended. Option D. Tourniquet pressure becomes lower. The correct answer is option A. Potassium may be falsely increased. Hemolysis releases intracellular potassium from red blood cells and can falsely elevate measured potassium. Patient demographics are not changed by cell rupture. A specimen problem cannot extend tube expiration. Tourniquet pressure is unrelated to the analyzer result after hemolysis. Question 29. When using a syringe for blood transfer, which method best protects specimen quality in the occupational health clinic during a practice drill? Option A. Remove the tube stopper and push blood in forcefully. Option B. Use a safety transfer device and allow blood to flow gently into tubes. Option C. Squirt blood through the needle into each tube. Option D. Shake each tube hard to remove clots. The correct answer is option B. Use a safety transfer device and allow blood to flow gently into tubes. A safety transfer device reduces needle stick risk and minimizes pressure-related cell damage. Removing stoppers increases exposure and contamination risk. Pushing blood through a needle can cause hemolysis and Sharp's injury. Shaking tubes can rupture cells and worsen specimen quality. Question 30. Why should alcohol be allowed to dry before puncture in the blood collection station during a scenario? Option A. Dry alcohol makes the tube additive stronger. Option B. Wet alcohol improves vein anchoring. Option C. Wet alcohol can cause stinging and may contribute to hemolysis or specimen contamination. Option D. Alcohol drying replaces tourniquet use. The correct answer is option C. Wet alcohol can cause stinging and may contribute to hemolysis or specimen contamination. Air drying supports proper antisepsis and prevents wet alcohol from entering the specimen path. Drying does not change the chemical strength of tube additives. Vein anchoring depends on hand technique, not wet alcohol. Tourniquet use is a separate step for vein distension. Question 31. To protect patient safety, which specimen often requires protection from light after collection in the outpatient clinic during a competency review? Option A. CBC specimen for platelet count. Option B. Routine sodium citrate coagulation tube. Option C. Blood culture bottle during incubation. Option D. Bilirubin specimen. The correct answer is option D. Bilirubin specimen. Bilirubin is light sensitive and may decrease if the specimen is exposed to light. CBC specimens require mixing and timely testing, not routine light protection for platelet count. Citrate coagulation specimens require correct fill and processing, not light protection as the key issue. Blood cultures require sterile handling and incubation, not wrapping for light protection as the primary step. Question 32. After reviewing the order, which specimen commonly requires rapid transport on ice or chilled handling according to policy in the hospital unit during morning rounds during a final review? Option A. Ammonia specimen. Option B. Routine CBC kept for the next day. Option C. Serum separator tube for a lipid panel after clotting only. Option D. Blood culture bottle placed in the freezer. The correct answer is option A. Ammonia specimen. Ammonia specimens are time-sensitive and commonly require chilling and prompt processing. A routine CBC should not simply be held for the next day without stability guidance. A lipid panel does not share the same immediate chilled handling requirement as ammonia. Blood culture bottles should not be frozen because organisms must remain viable for detection. Question 33. When preparing for collection, which action best maintains specimen integrity during transport to the laboratory in the urgent care laboratory during a study session? Option A. Store every specimen at room temperature overnight. Option B. Follow required time, temperature, light, and handling instructions for the ordered test. Option C. Centrifuge every tube immediately regardless of type. Option D. Place all blood specimens in direct sunlight. The correct answer is option B. Follow required time, temperature, light, and handling instructions for the ordered test. Different tests have specific stability requirements, so handling must match the test and facility policy. Overnight room temperature storage can make many specimens unacceptable. Some tubes should not be centrifuged immediately or at all before required steps. Sunlight can degrade light-sensitive analytes and warm specimens. Question 34. If a specimen must be transported cold, which approach is appropriate while preparing a blood culture specimen in the pediatric clinic? Option A. Submerge the tube in loose ice water. Option B. Hold it in a bare hand to keep it visible. Option C. Place the specimen in the approved cooling method without direct water contamination. Option D. Place it near a heater until pickup. The correct answer is option C. Place the specimen in the approved cooling method without direct water contamination. Cooling must preserve the required temperature while protecting the label and tube from contamination or leakage. Loose ice water can damage labels and create contamination issues. Holding the specimen warms it and defeats the cold requirement. A heater can destabilize temperature-sensitive analytes. Question 35. Before proceeding with the draw, which situation is a common reason for specimen rejection in the long-term care unit during a clinical simulation? Option A. Collector wore gloves. Option B. Patient stated date of birth. Option C. Tube was labeled at the bedside. Option D. Wrong tube type or insufficient specimen volume. The correct answer is option D. Wrong tube type or insufficient specimen volume. Wrong container choice or inadequate volume can prevent accurate testing and may require recollection. Wearing gloves is expected when blood exposure is possible. Patient-stated identifiers support accurate identification. Bedside labeling is the correct practice. Question 36. Why should tube expiration dates be checked before collection while preparing a type and screen specimen in the mobile collection site? Option A. Expired tubes may have inadequate vacuum or unreliable additive performance. Option B. Expired tubes identify patients faster. Option C. Expired tubes prevent hemolysis in every case. Option D. Expired tubes are required for coagulation testing. The correct answer is option A. Expired tubes may have inadequate vacuum or unreliable additive performance. Tube vacuum and additive quality can decline after expiration, compromising specimen volume or test accuracy. Expiration dates do not help verify identity. No expired tube can guarantee hemolysis prevention. Coagulation testing requires properly filled, unexpired citrate tubes. Question 37. A patient scheduled for a fasting lipid panel says they ate breakfast. Which action is best in the emergency department bay during a mock exam? Option A. Draw the specimen and write fasting on the label. Option B. Follow facility policy by notifying the appropriate person and documenting or rescheduling as directed. Option C. Tell the patient not to mention the meal. Option D. Cancel every test without notifying anyone. The correct answer is option B. Follow facility policy by notifying the appropriate person and documenting or rescheduling as directed. Fasting status affects certain tests, so the discrepancy must be handled through policy and communication. Marking the specimen as fasting would be inaccurate documentation. Hiding the meal prevents proper interpretation of results. Canceling without communication may disrupt care and exceed the phlebotomist's role. Question 38. Why is fasting status important before some chemistry tests in the physician office lab during a skills check? Option A. Food changes the patient's legal name. Option B. Fasting makes needles sterile. Option C. Food intake can alter analytes such as glucose or lipids. Option D. Fasting eliminates the need for tube mixing. The correct answer is option C. Food intake can alter analytes such as glucose or lipids. Some blood values vary after eating, so fasting helps standardize interpretation. Food intake does not affect patient identity. Sterility comes from equipment and technique, not fasting. Additive tubes still require proper mixing regardless of fasting status. Question 39. For a medication trough level, when is the specimen usually collected in the community health screening event during a practice drill? Option A, immediately after the medication is swallowed. Option B, at any random time during the day. Option C, only after the medication is discontinued for a week. Option D, immediately before the next scheduled dose. The correct answer is option D, immediately before the next scheduled dose. A trough measures the lowest drug concentration, typically just before the next dose. Immediately after dosing reflects absorption or peak timing, not trough. Random timing can make therapeutic drug results difficult to interpret. Stopping medication for a week is not the routine way to collect a trough. Question 40. During a glucose tolerance test, why must collection times be followed carefully in the preoperative testing area during a scenario? Option A, timed results show how the body responds to a measured glucose dose. Option B, any time is acceptable if the tubes are gray. Option C, timing only matters after the last tube. Option D, the patient should eat between timed draws to stay comfortable. The correct answer is option A. Timed results show how the body responds to a measured glucose dose. Glucose tolerance testing depends on comparing specimens at specific intervals after glucose administration. Tube type does not remove the need for precise timing. Every scheduled interval matters for interpretation. Eating during the test can invalidate the glucose response pattern. Question 41. When preparing for collection, which documentation is especially important for a timed specimen in the Oncology Infusion Center during a competency review? Option A, the phlebotomist's favorite tube brand. Option B, exact collection time recorded on the label or requisition according to policy. Option C, only the patient's room number. Option D, a note saying collected sometime today. The correct answer is option B, exact collection time recorded on the label or requisition according to policy. Timed tests require accurate collection times so results can be interpreted correctly. Tube brand does not communicate timing. Room number is not a valid substitute for collection time. Vague timing can make the specimen clinically unreliable. Question 42. Before collecting blood cultures, why is careful skin antisepsis critical in the dialysis-adjacent clinic during a final review? Option A, it makes EDTA tubes clot faster. Option B, it eliminates the need for sterile bottles. Option C, it reduces contamination that could cause a false positive culture. Option D, it changes venous blood into arterial blood. The correct answer is option C. It reduces contamination that could cause a false positive culture. Blood cultures are highly sensitive to skin organisms, so antisepsis helps ensure organisms detected are clinically meaningful. EDTA clotting is unrelated to culture site preparation. Sterile collection containers are still required. Skin antisepsis does not change the type of blood collected. Question 43. When collecting blood cultures with other tubes, which priority is most important in the student skills lab during a study session? Option A, collect cultures after gray tubes. Option B, touch the bottle tops after cleaning to confirm dryness. Option C, use a non-sterile transfer cup. Option D, maintain sterility and collect cultures before non-sterile tubes. The correct answer is option D. Maintain sterility and collect cultures before non-sterile tubes. Blood cultures must be protected from contamination because false positives can lead to unnecessary treatment. Collecting cultures after other tubes increases contamination risk. Touching clean tops can recontaminate them. A non-sterile transfer process defeats the purpose of sterile collection. Question 44. If using a winged set for blood cultures, why is bottle order guided by facility policy in the occupational health clinic during a structured exam prep drill? Option A. Air in the tubing can affect which bottle should be filled first. Option B. The order determines the patient's identity. Option C. The order prevents the need to clean the site. Option D. The order makes the needle reusable. The correct answer is option A. Air in the tubing can affect which bottle should be filled first. Butterfly tubing contains air, and culture bottle order may be chosen to manage that air safely. Bottle order does not verify patient identity. Skin and bottle antisepsis are still required. Needles are single-use and cannot be reused. Question 45. For illegal blood alcohol collection, which requirement is especially important in the blood collection station during a clinical simulation? Option A. Use alcohol swabs for every blood alcohol specimen. Option B. Maintain chain of custody documentation and use the required non-alcohol antiseptic if specified. Option C. Leave the specimen unlabeled until court. Option D. Let the patient carry the open tube to the lab. The correct answer is option B. Maintain chain of custody documentation and use the required non-alcohol antiseptic if specified. Legal specimens require strict identity, handling, and documentation controls to preserve admissibility and integrity. Alcohol antiseptic may contaminate alcohol testing and may be prohibited by protocol. Unlabeled legal specimens break traceability. Allowing the patient to carry an open specimen compromises custody and security. Question 46. For a CBC collection, which action best supports chain of custody for a drug screen specimen? Option A. Use only verbal handoff with no signatures. Option B. Store the specimen in an unlocked public area. Option C. Document each person who handles the specimen from collection to transfer. Option D. Discard the seal after collection. The correct answer is option C. Document each person who handles the specimen from collection to transfer. Chain of custody proves who had control of the specimen at each step. Verbal handoff alone does not create a traceable legal record. Unsecured storage can compromise specimen integrity. A broken or discarded seal weakens evidence of tamper control. Question 47. Why are tamper-evident seals used on forensic or workplace testing specimens in the hospital unit during morning rounds during a mock exam? Option A. They replace patient consent. Option B. They make refrigeration unnecessary for all tests. Option C. They prevent the need for a requisition. Option D. They help show whether the specimen was opened or altered after collection. The correct answer is option D. They help show whether the specimen was opened or altered after collection. Tamper-evident seals support specimen integrity by making unauthorized opening visible. A seal does not replace required consent or authorization. Temperature requirements still depend on the test. A requisition or custody form is still needed for proper processing. Question 48. For an infant heel stick, which area is safest for puncture in the urgent care laboratory during a skills check? Option A. Medial or lateral plantar surface of the heel. Option B. Posterior curvature of the heel. Option C. Center of the arch. Option D. Tip of the great toe. The correct answer is option A. Medial or lateral plantar surface of the heel. The medial or lateral plantar heel avoids deeper structures when an appropriate lancet depth is used. The posterior curvature increases risk of bone injury. The arch is not an approved heel stick site. The great toe is not the standard infant heel stick site. Question 49. Why should an infant heel puncture not be too deep in the pediatric clinic during a practice drill? Option A. A deeper puncture always prevents hemolysis. Option B. Excessive depth can injure bone or deeper tissue. Option C. Depth determines the tube color. Option D. A deep puncture replaces the need for warming. The correct answer is option B. Excessive depth can injure bone or deeper tissue. Infants have small heels, and excessive lancet depth can damage underlying structures. Deeper puncture can increase injury and does not guarantee specimen quality. Tube color is selected by test requirements, not puncture depth. Warming is a separate step used to improve blood flow when appropriate. Question 50. In a routine phlebotomy scenario, which finger is generally preferred for adult capillary puncture in the long-term care unit during a scenario? Option A, thumb pad for every test. Option B, index fingertip in all adults. Option C, middle or ring finger on the palmar surface near the side of the fingertip. Option D, little finger near the bone. The correct answer is option C. Middle or ring finger on the palmar surface near the side of the fingertip. The middle or ring finger usually has adequate tissue and less callus than other fingers. The thumb may be more calloused and is not the routine first choice. The index finger is often more sensitive and calloused. The little finger has less tissue over bone and higher injury risk. Question 51. After a finger puncture, why is the first drop of blood commonly wiped away in the mobile collection site during a competency review? Option A. It contains only white blood cells. Option B. It proves the patient is fasting. Option C. It activates the tube vacuum. Option D. It may contain tissue fluid or contaminants that can affect the specimen. The correct answer is option D. It may contain tissue fluid or contaminants that can affect the specimen. The first drop can be diluted with tissue fluid or skin contaminants, so wiping it improves specimen quality for many tests. The first drop is not composed only of white blood cells. Fasting status cannot be determined from the first drop. Capillary collection does not depend on evacuated tube vacuum at the puncture site. Question 52. How can warming a capillary puncture site help collection in the emergency department bay during a final review? Option A. It increases local blood flow when used safely. Option B. It sterilizes the skin completely. Option C. It removes the need to identify the patient. Option D. It makes every specimen suitable for culture. The correct answer is option A. It increases local blood flow when used safely. Warmth can improve capillary blood flow and reduce the need for excessive squeezing. Warming does not sterilize skin. Patient identification is still mandatory. Capillary specimens are not automatically suitable for blood culture collection. Question 53. Why should excessive squeezing or milking be avoided during capillary collection in the physician office lab during a study session? Option A. It improves all glucose results. Option B. It can dilute the specimen with tissue fluid and cause hemolysis. Option C. It makes EDTA unnecessary. Option D. It prevents clotting in serum tubes. The correct answer is option B. It can dilute the specimen with tissue fluid and cause hemolysis. Excessive pressure can alter specimen composition and damage cells. Glucose results can be affected by poor specimen quality rather than improved. EDTA is still needed when an EDTA microtube is required. Serum tubes are intended to clot and are not protected by squeezing. Question 54. When is dermal puncture commonly preferred over venipuncture in the community health screening event during a structured exam prep drill? Option A. For every blood culture set. Option B. For all coagulation studies regardless of policy. Option C. For some infants, small volume tests, or patients with difficult veins when appropriate. Option D. Whenever patient identification is incomplete. The correct answer is option C. For some infants, small volume tests, or patients with difficult veins when appropriate. Dermal puncture can be useful when only small volumes are needed or venipuncture is difficult. Blood cultures usually require sterile venipuncture collection and adequate volume. Coagulation testing has strict specimen requirements and is not automatically dermal. Incomplete identification must be resolved before any collection method. Question 55. A child begins to pull away during a draw. Which action supports safety in the preoperative testing area during a clinical simulation? Option A. Continue while the arm is moving. Option B. Scold the child until they stop. Option C. Ask another child to hold the arm. Option D. Pause if needed and obtain appropriate assistance for safe positioning according to policy. The correct answer is option D. Pause if needed and obtain appropriate assistance for safe positioning according to policy. Safe positioning prevents sudden movement that could injure the child or phlebotomist. Continuing while the arm moves increases injury risk. Scolding is not therapeutic and can escalate fear. Another child is not appropriate assistance for a procedure. Question 56. After reviewing the order, which explanation is best for a young child before a finger stick in the oncology infusion center during a review? Option A. Use simple honest words such as a quick pinch and explain what they can do to help. Option B. Tell the child nothing will happen. Option C. Use detailed adult medical terminology. Option D. Promise a toy only if they do not cry. The correct answer is option A. Use simple honest words such as a quick pinch and explain what they can do to help. Age-appropriate honesty helps the child understand and cooperate without unnecessary fear. Saying nothing will happen is misleading. Complex terminology can confuse or frighten a young child. Tying a reward to not crying can shame a normal fear response. Question 57. For an older adult with fragile veins, which technique is most appropriate in the dialysis-adjacent clinic during a mock exam? Option A. Slap the site hard to make veins appear. Option B. Use gentle anchoring and consider a smaller needle or controlled collection device. Option C. Use the largest needle available. Option D. Leave the tourniquet on for several minutes. The correct answer is option B. Use gentle anchoring and consider a smaller needle or controlled collection device. Fragile veins need careful stabilization and equipment that reduces trauma or collapse. Slapping can injure delicate skin and is unprofessional. A large needle can worsen trauma. Prolonged tourniquet time increases hemoconcentration and bruising risk. Question 58. Why should adhesive bandages be used carefully on some older adults in the student skills lab during a skills check? Option A. Adhesive changes the blood type. Option B. Older adults never need pressure after draws. Option C. Fragile skin can tear when adhesive is removed. Option D. Bandages prevent all anticoagulant bleeding. The correct answer is option C. Fragile skin can tear when adhesive is removed. Aging skin may be thin and easily damaged, so pressure wrap or gentle dressing choices may be needed. Adhesive has no effect on blood type. Older adults still need pressure until bleeding stops. A bandage does not eliminate bleeding risk, especially with anticoagulants. Question 59. Before assembling equipment for a ammonia draw, which item should be checked in the occupational health clinic during a practice drill? Option A. Only the color of the chair. Option B. The patient's favorite beverage. Option C. The brand of wall clock in the room. Option D. Tube type, expiration date, needle safety device, and requisition requirements. The correct answer is option D. Tube type, expiration date, needle safety device, and requisition requirements. Checking supplies before collection helps prevent wrong container use, expired tubes, and safety device problems. Chair color has no role in specimen acceptability. Favorite beverage is not part of collection equipment verification. The wall clock brand does not confirm correct supplies or orders. Question 60. During a scenario, which sequence is safest after blood has entered the final tube in the blood collection station during a scenario? Option A. Release tourniquet, remove tube, place gauze, withdraw needle, activate safety device, apply pressure. Option B, withdraw needle with tourniquet tight and no gauze ready. Option C, activate safety device before removing the needle from the arm. Option D, remove the needle and recap it before pressure. The correct answer is option A. Release tourniquet, remove tube, place gauze, withdraw needle, activate safety device, apply pressure. The final steps should reduce venous pressure, prepare for bleeding control, and secure the sharp immediately. Withdrawing with the tourniquet tight can increase bleeding and bruising. Most safety devices are activated after withdrawal unless the device instructions say otherwise. Recapping a contaminated needle creates sharp's injury risk. Question 61. In the outpatient clinic, which action should occur before leaving the patient after venipuncture? Option A, leave while blood is still oozing. Option B, confirm bleeding has stopped and provide appropriate post-draw instructions. Option C, tell the patient to remove the bandage immediately. Option D, dispose of sharps after walking to another room. The correct answer is option B. Confirm bleeding has stopped and provide appropriate post-draw instructions. Post-draw assessment helps prevent bleeding, bruising, and delayed complications. Leaving active bleeding unattended is unsafe. Immediate bandage removal can restart bleeding. Sharps must be disposed of promptly in the collection area. Question 62. Why is patient positioning important before venipuncture in the hospital unit during morning rounds during a final review? Option A. It makes labeling unnecessary. Option B. It changes EDTA into citrate. Option C. It reduces the risk of falls or injury if the patient becomes dizzy. Option D. It allows the needle to be reused safely. The correct answer is option C. It reduces the risk of falls or injury if the patient becomes dizzy. A seated or lying position with arm support protects the patient if syncope occurs. Proper positioning does not replace specimen labeling. Body position does not change tube additives. Needles are single-use and cannot be reused. Question 63. To protect patient safety, which patient instruction is appropriate after a routine venipuncture in the urgent care laboratory during a study session? Option A, scratch the site if it feels itchy. Option B, remove the bandage while still bleeding. Option C, bend the elbow tightly for 10 minutes. Option D, keep pressure on the site and avoid heavy lifting with that arm for a short time if advised. The correct answer is option D. Keep pressure on the site and avoid heavy lifting with that arm for a short time if advised. Post-draw instructions support clot formation and reduce bruising or bleeding. Scratching can disrupt the site and introduce contamination. Removing a bandage during bleeding can restart or worsen bleeding. Bending the elbow tightly can increase bruising. Question 64. After reviewing the order, which laboratory department commonly performs CBC testing? Option A, hematology. Option B, microbiology only. Option C, blood bank only. Option D, histology only. The correct answer is option A. Hematology. Hematology evaluates blood cells and commonly performs CBC testing. Microbiology focuses on organisms and cultures. Blood bank focuses on compatibility and transfusion-related testing. Histology focuses on tissue specimens rather than routine CBC testing. Question 65. When preparing for collection, which department usually performs patient and APTT coagulation testing? Option A, urinalysis only. Option B, coagulation or hematology coagulation section. Option C, microbiology culture bench only. Option D, cytology screening only. The correct answer is option B. Coagulation or hematology coagulation section. Coagulation testing evaluates clotting pathways and is commonly handled in a coagulation section. Urinalysis focuses on urine specimens. Microbiology culture benches identify organisms rather than routine clotting times. Cytology examines cells for diagnostic changes, not standard coagulation studies. Question 66. In a routine phlebotomy scenario, which department is most associated with blood cultures? Option A, blood bank compatibility only. Option B, histology tissue processing. Option C, microbiology. Option D, chemistry electrolyte analysis only. The correct answer is option C, microbiology. Microbiology processes cultures to detect and identify microorganisms. Blood bank testing focuses on transfusion compatibility. Histology processes tissue rather than blood culture bottles. Chemistry analyzes chemical constituents and is not the main culture department. Question 67. Before proceeding with the draw, which department commonly performs type and screen testing? Option A, microbiology only. Option B, chemistry only. Option C, parasitology stool testing only. Option D, blood bank or transfusion services. The correct answer is option D, blood bank or transfusion services. Blood bank testing supports transfusion safety by determining blood type and antibody screen results. Microbiology focuses on infectious organisms. Chemistry focuses on analytes such as glucose and electrolytes. Parasitology stool testing does not perform transfusion compatibility testing. Question 68. During a skills check, which department commonly analyzes electrolytes such as sodium and potassium? Option A, chemistry. Option B, histology. Option C, blood bank compatibility bench. Option D, cytogenetics only. The correct answer is option A, chemistry. Chemistry measures dissolved analytes such as electrolytes, enzymes, hormones, and metabolites. Histology focuses on tissues. Blood bank compatibility testing is not the routine electrolyte section. Cytogenetics focuses on chromosomes or genetic studies, not routine electrolytes. Question 69. In the community health screening event, which activity is commonly associated with CLIA waived point of care testing? Option A, changing the test procedure to save time. Option B, following manufacturer instructions and documenting quality control for a simple approved test. Option C, reporting results without controls when controls are required. Option D, using expired test strips because they look normal. The correct answer is option B, following manufacturer instructions and documenting quality control for a simple approved test. Waived testing is simple but still requires following instructions, QC, and documentation. Modifying the procedure can invalidate the test category and results. Skipping required controls undermines result reliability. Expired strips may produce inaccurate results even if they look acceptable. Question 70. Before performing a fingerstick glucose test, which step supports accurate point-of-care results in the preoperative testing area during a scenario? Option A, use a strip from an unlabeled loose container. Option B, skip patient identification because the device stores results. Option C, confirm test strip expiration and run required quality control according to policy. Option D, apply disinfectant and test before the site dries. The correct answer is option C, confirm test strip expiration and run required quality control according to policy. Expiration checks and QC help ensure the device and strips are producing reliable results. Loose unlabeled strips may be expired or contaminated. Device storage does not replace identifying the patient. Testing before the site dries can contaminate or dilute the sample. Question 71. Why must abnormal point-of-care results be handled according to facility policy in the Oncology Infusion Center during a competency review? Option A, abnormal results should always be erased. Option B, only normal results belong in the medical record. Option C, the patient should interpret the result without staff involvement. Option D. Critical or unexpected results may require confirmation, documentation, or immediate notification. The correct answer is option D. Critical or unexpected results may require confirmation, documentation, or immediate notification. Policies define how to verify, document, and communicate results that may affect patient care. Erasing abnormal results hides clinically important information. Both normal and abnormal results may require documentation. Patients should receive appropriate clinical guidance rather than interpreting serious results alone. Question 72. After reviewing the order, which blood component is primarily responsible for carrying oxygen in the dialysis-adjacent clinic during a final review? Option A. Hemoglobin inside red blood cells. Option B. Sodium citrate in plasma. Option C. Platelet granules only. Option D. Tube separation gel. The correct answer is option A. Hemoglobin inside red blood cells. Hemoglobin within red blood cells binds and transports oxygen throughout the body. Sodium citrate is a tube additive, not an oxygen carrier. Platelets help hemostasis but do not primarily transport oxygen. Separation gel is part of a tube system, not a blood component. Question 73. When preparing for collection, which blood component is most directly involved in forming the initial platelet plug in the student skills lab during a study session? Option A. Albumin only. Option B. Platelets. Option C. Glucose molecules. Option D. Chloride ions. The correct answer is option B. Platelets. Platelets adhere and aggregate at injury sites to begin primary hemostasis. Albumin helps maintain oncotic pressure and transport substances but is not the platelet plug. Glucose is an energy source, not a clotting cell fragment. Chloride is an electrolyte and does not form platelet plugs. Question 74. In a routine phlebotomy scenario, which vessel type is normally used for routine venipuncture in the occupational health clinic during a structured exam prep drill? Option A. Artery. Option B. Lymphatic duct. Option C. Vein. Option D. Tendon sheath. The correct answer is option C. Vein. Veins are lower pressure vessels that are routinely accessed for diagnostic blood collection. Arterial puncture is a different procedure and not routine venipuncture. Lymphatic ducts do not provide venous blood specimens. A tendon sheath is not a blood vessel and must be avoided. Question 75. Why is the basilic vein approached with extra caution in the blood collection station during a clinical simulation? Option A. It contains no venous blood. Option B. It always has a built-in tourniquet. Option C. It cannot be palpated in any patient. Option D. It lies near nerves and arteries in the antecubital area. The correct answer is option D. It lies near nerves and arteries in the antecubital area. The basilic area has nearby structures that increase the consequence of poor needle placement. The basilic vein does contain venous blood. No vein has a built-in tourniquet. The vein may be palpable, but caution is still needed because of anatomy. Question 76. During a review, which term describes stopping bleeding after vessel injury in the outpatient clinic during a review? Option A. Hemostasis. Option B. Hemolysis. Option C. Glycolysis. Option D. Hemoconcentration. The correct answer is option A. Hemostasis. Hemostasis is the process that stops bleeding through vascular response, platelets, and coagulation. Hemolysis is red cell rupture. Glycolysis is glucose metabolism by cells. Hemoconcentration is increased concentration of blood components from fluid shifts. Question 77. A clotted lavender tube is received for CBC testing. Why is recollection usually needed in the hospital unit during morning rounds during a mock exam? Option A. Clotting proves the patient was fasting. Option B. Clots trap cells and make cell counts unreliable. Option C. Clots improve automated CBC accuracy. Option D. Lavender tubes are supposed to clot before testing. The correct answer is option B. Clots trap cells and make cell counts unreliable. CBC testing requires a well-mixed anticoagulated specimen so cells remain evenly suspended. Fasting status is unrelated to clot formation in an EDTA tube. Clots can block analyzers or distort cell counts. Lavender tubes contain EDTA and should not clot when properly mixed and filled. Question 78. An underfilled light blue tube arrives for patient testing. What is the main concern in the urgent care laboratory during a skills check? Option A. The specimen will become a blood culture. Option B. The tube will automatically refill in the lab. Option C. Excess citrate relative to blood may alter coagulation results. Option D. The patient's identity becomes verified. The correct answer is option C. Excess citrate relative to blood may alter coagulation results. Underfilling changes the anticoagulant to blood ratio and can make coagulation results inaccurate. A citrate tube cannot become a blood culture bottle. Tubes do not refill after collection. Fill volume has no role in verifying identity. Question 79. To protect patient safety, which additive can falsely increase potassium if carried into a chemistry tube in the pediatric clinic during a practice drill? Option A. Clot activator gel only. Option B. Sodium fluoride without potassium. Option C. Sterile culture broth only. Option D. Potassium EDTA. The correct answer is option D. Potassium EDTA. Potassium EDTA carryover can contaminate chemistry specimens and falsely elevate potassium while lowering calcium. Gel itself does not add potassium in the same way EDTA contamination does. Sodium fluoride is associated with glucose preservation, not potassium EDTA effects. Culture broth is used for organism recovery and is not the classic potassium carryover problem. Question 80. After reviewing the order, which tube should generally be collected before a lavender EDTA tube in venipuncture order in the long-term care unit during a scenario? Option A. Green heparin tube. Option B. Gray fluoride tube after lavender only. Option C. Another lavender tube for every test. Option D. No tube because EDTA always comes first. The correct answer is option A. Green heparin tube. In the standard sequence, heparin tubes are collected before EDTA tubes to limit additive carryover effects. Gray tubes generally follow EDTA, not preceded as the key before lavender tube. Collecting another lavender tube does not answer the order requirement. EDTA does not always come first and can interfere with later tests. Question 81. When preparing for collection, which instruction is commonly given for a fasting blood test unless policy says otherwise in the mobile collection site during a competency review? Option A. Drink sugary beverages before arrival. Option B. Avoid food and most beverages except water for the required fasting period. Option C. Chew gum with sugar during the fast. Option D. Eat a small snack because it will not matter. The correct answer is option B. Avoid food and most beverages except water for the required fasting period. Fasting helps standardize results for tests affected by recent food intake. Sugary beverages can alter glucose and other chemistry results. Sugared gum can break the fast for some testing instructions. A snack can invalidate fasting status for tests that require it. Question 82. If a timed specimen is collected late, which action is most appropriate in the emergency department bay during a final review? Option A. Write the scheduled time on the label anyway. Option B. Discard the requisition without telling anyone. Option C. Document the actual collection time and notify the appropriate person according to policy. Option D. Change the patient's medication schedule independently. The correct answer is option C. Document the actual collection time and notify the appropriate person according to policy. Actual collection time is necessary to interpret timed results and decide whether recollection is needed. Writing the scheduled time is inaccurate documentation. Discarding the order without communication disrupts care. Medication timing decisions are outside routine phlebotomy authority. Question 83. Before proceeding with the draw, which action increases the chance of blood culture contamination in the physician office lab during a study session? Option A, allowing antiseptic to dry. Option B, using sterile culture bottles. Option C, collecting cultures before other tubes. Option D, repulpating the cleansed site with an unclean glove before needle insertion. The correct answer is option D. Repulpating the cleansed site with an unclean glove before needle insertion. Touching the disinfected site with an unclean glove can reintroduce skin organisms. Allowing antiseptic to dry supports effective skin preparation. Sterile bottles help maintain specimen integrity. Collecting cultures first helps reduce contamination from other tubes. Question 84. During a structured exam prep drill, which behavior is outside appropriate phlebotomy scope in a routine collection setting in the community health screening event during a structured exam prep drill? Option A, interpreting the diagnosis and changing the provider's order independently. Option B, verifying patient identity. Option C, labeling the specimen at the bedside. Option D, reporting a specimen problem to the supervisor. The correct answer is option A. Interpreting the diagnosis and changing the provider's order independently. Phlebotomists collect and handle specimens but do not independently diagnose or alter provider orders. Identity verification is a core phlebotomy responsibility. Bedside labeling is expected practice. Reporting problems supports patient safety and quality assurance. Question 85. A patient asks when results will be ready. Which response is most appropriate in the preoperative testing area during a clinical simulation? Option A, guess a diagnosis from the tube color. Option B, explain that the laboratory or provider will report results according to facility process. Option C, promise exact results in 5 minutes for every test. Option D, tell the patient results are not their concern. The correct answer is option B. Explain that the laboratory or provider will report results according to facility process. The phlebotomist can provide general process information without interpreting or promising results outside their role. Tube color does not allow diagnosis. Turnaround time varies by test and setting, so a universal promise is unsafe. Dismissive language is unprofessional and does not support patient-centered care. Question 86. For a electrolyte panel collection, which disposal choice is correct for blood-soaked gauze after a draw? Option A, place it in the sharps container. Option B, put it in a clean supply drawer. Option C, place it in the appropriate biohazard waste container according to policy. Option D, hand it to the next patient to hold. The correct answer is option C. Place it in the appropriate biohazard waste container according to policy. Blood-contaminated soft waste belongs in the designated biohazard stream when required by policy. Sharps containers are reserved for needles and other sharps, not soft gauze. A supply drawer must remain clean and uncontaminated. Giving contaminated gauze to another patient creates exposure risk. Question 87. To protect patient safety, which item should never be stored with clean blood collection supplies in the dialysis adjacent clinic during a mock exam? Option A, unopened sterile needles. Option B, unexpired evacuated tubes. Option C, clean tourniquets ready for use. Option D, used needles or blood-contaminated materials. The correct answer is option D. Used needles or blood-contaminated materials. Clean supplies must be protected from contamination to prevent patient exposure and specimen problems. Unopened sterile needles are appropriate clean supplies when stored correctly. Unexpired tubes belong with clean collection inventory. Clean tourniquets can be stored for patient use if facility policy permits. Question 88. After reviewing the order, which action helps prevent leakage during specimen transport in the student skills lab during a skills check? Option A. Ensure the tube is closed securely and placed in approved transport packaging. Option B. Loosen the stopper to release pressure. Option C. Carry open tubes by hand. Option D. Place tubes loose in a coat pocket. The correct answer is option A. Ensure the tube is closed securely and placed in approved transport packaging. Secure closure and proper packaging protects staff, couriers, and specimen integrity. Loosening the stopper can cause leaks and exposure. Open tubes increase spill and contamination risk. A coat pocket is not approved specimen transport packaging. Question 89. A serum tube and lavender tube are ordered after blood cultures and citrate, which should be collected first in the occupational health clinic during a practice drill. Option A. Lavender before serum. Option B. Serum tube before lavender tube. Option C. Gray before both in every case. Option D. Order does not matter if both are mixed. The correct answer is option B. Serum tube before lavender tube. Serum tubes are collected before EDTA tubes to reduce EDTA carryover into chemistry specimens. Lavender first can contaminate the serum tube with EDTA. Gray tubes are generally later in the order and are not automatically before serum. Mixing tubes does not correct additive carryover. Question 90. In a routine phlebotomy scenario, which tube is most associated with ESR testing in many phlebotomy settings in the blood collection station during a scenario? Option A. Blood culture bottle only. Option B. Gray fluoride tube for every ESR. Option C. Lavender EDTA tube or designated black citrate tube depending on method. Option D. SST for all ESR methods. The correct answer is option C. Lavender EDTA tube or designated black citrate tube depending on method. ESR collection depends on the facility method, commonly EDTA or a designated citrate ESR tube. Blood culture bottles are for microbiology cultures. Gray fluoride tubes are not the usual universal ESR container. SST serum is not appropriate for all ESR methods because ESR evaluates cellular settling. Question 91. Why should serum tubes be allowed to clot before centrifugation unless policy states otherwise in the outpatient clinic during a competency review? Option A. Clotting makes EDTA work faster. Option B. Early centrifugation improves blood culture growth. Option C. Serum tubes contain no blood cells. Option D. Centrifuging too early can leave fibrin strands and compromise serum quality. The correct answer is option D. Centrifuging too early can leave fibrin strands and compromise serum quality. Serum specimens need adequate clot formation so serum separates cleanly after centrifugation. EDTA is not the additive in a serum tube. Blood culture growth is unrelated to serum tube clotting. Serum tubes initially contain whole blood cells before clotting and separation. Question 92. During a final review, which tube should not be centrifuged before it has clotted when serum is required in the hospital unit during morning rounds during a final review? Option A. Red top or serum separator tube. Option B. Lavender EDTA tube for CBC. Option C. Light blue citrate tube for patient. Option D. Gray fluoride tube for glucose. The correct answer is option A. Red top or serum separator tube. Serum tubes must clot before centrifugation to obtain clear serum and avoid fibrin problems. Lavender CBC specimens are whole blood and are not clotted for serum. Light blue specimens are anticoagulated plasma for coagulation testing. Gray specimens contain additives for glucose preservation and are not serum clot tubes. Question 93. In the urgent care laboratory, which action is appropriate if a patient has a latex allergy? Option A. Use latex equipment briefly because exposure is short. Option B. Use latex-free equipment and follow facility allergy precautions. Option C. Ignore the allergy if gloves are powder-free. Option D. Ask the patient to hold the latex tourniquet away from the skin. The correct answer is option B. Use latex-free equipment and follow facility allergy precautions. Latex-sensitive patients require latex-free supplies to prevent allergic reactions. Short exposure can still trigger a reaction. Powder-free latex may still contain latex proteins. Having the patient hold latex does not remove exposure risk. Question 94. For a blood culture collection, which mismatch requires resolution before drawing blood? Option A. The patient is wearing a sweater. Option B. The collection tray has extra gauze. Option C. The requisition name does not match the patient's wristband. Option D. The phlebotomist has 2 tube holders. The correct answer is option C. The requisition name does not match the patient's wristband. An identity mismatch can lead to a wrong patient specimen and must be corrected before collection. Clothing choice does not create an identification conflict. Extra gauze does not affect patient identity. Having additional clean equipment does not create a patient mismatch. Question 95. During downtime when barcode labels are unavailable, what should guide specimen labeling in the long-term care unit during a clinical simulation? Option A. No labels until the computer returns. Option B. Labels borrowed from another patient. Option C. Memory of the patient after the shift. Option D. Approved manual identification and labeling procedure. The correct answer is option D. Approved manual identification and labeling procedure. Downtime procedures are designed to maintain traceability when electronic systems are unavailable. Unlabeled specimens are unsafe and may be rejected. Borrowed labels cause wrong patient errors. Memory after the shift is not a reliable labeling method. Question 96. After reviewing the order, which action reduces Sharp's injury risk immediately after withdrawing the needle in the mobile collection site during a review? Option A. Activate the safety feature as designed and dispose of the device promptly. Option B. Carry the exposed needle to the lab. Option C. Set the exposed needle on the bed. Option D. Hand the exposed needle to a coworker. The correct answer is option A. Activate the safety feature as designed and dispose of the device promptly. Safety activation and prompt disposal isolate the Sharp before it injures someone. Carrying an exposed needle increases injury risk during transport. A bed is not a safe surface for a contaminated Sharp. Passing an exposed needle puts the coworker at risk. Question 97. Why should reusable tourniquets be cleaned or replaced according to policy in the emergency department bay during a mock exam? Option A. They change venous blood into serum. Option B. They can become contaminated between patients. Option C. They make citrate tubes underfill. Option D. They replace the need for gloves. The correct answer is option B. They can become contaminated between patients. Tourniquets contact patient skin and the environment, so cleaning or single patient use prevents cross-contamination. A tourniquet does not determine whether blood becomes serum. Citrate tube fill depends on collection volume and vacuum, not tourniquet cleaning. Gloves are still needed when blood exposure is possible. Question 98. In a routine phlebotomy scenario, which action helps keep a cleaned venipuncture site uncontaminated? Option A. Fan the site with the requisition. Option B. Place the used alcohol pad back on the site. Option C. Do not touch the site again unless repulpating with a sterile or policy-approved method. Option D. Scratch the site to improve blood flow. The correct answer is option C. Do not touch the site again unless repulpating with a sterile or policy-approved method. Avoiding recontamination preserves the effect of skin antisepsis before puncture. Fanning with paperwork can introduce contaminants. A used alcohol pad is contaminated after use. Scratching damages skin and contaminates the puncture area. Question 99. Before proceeding with the draw, which situation requires immediate cleanup or removal from the draw area? Option A sealed sterile needle in its package. Option B. A printed order in the correct patient's chart. Option C. A clean unopened gauze packet. Option D. A contaminated needle holder or blood on the work surface. The correct answer is option D. A contaminated needle holder or blood on the work surface. Contaminated surfaces and equipment can expose staff and patients to blood-borne pathogens. A sealed sterile needle package is clean until opened. A correctly placed order does not create a contamination hazard. Clean unopened gauze is appropriate collection supply. Question 100. During a scenario, which documentation habit is most defensible after an unsuccessful draw attempt? Option A. Record the attempt and outcome according to facility policy. Option B. Erase the attempt because no specimen was obtained. Option C. Chart that the patient refused even if they did not. Option D. Blame the patient in informal language. The correct answer is option A. Record the attempt and outcome according to facility policy. Accurate documentation creates a truthful record and supports continuity of care. Deleting the attempt hides relevant clinical information. False refusal documentation is unethical and inaccurate. Informal blame language is unprofessional and not objective.